name is Heather Harrell, and I am the co-clerkship director for internal medicine at the University of Florida, and I also direct our learning communities. And I am the senior director for high value care at Aquifer. So I have been passionate about high value care before it was called high value care, and arranged some experiences for our students where they could get copies of their patients' bills, and they found that extremely interesting, and some other opportunities for them to reflect about the cost of care, talking with some of the case managers and social workers. And this was very popular with our students, but what I didn't know is what is the foundational information that they really need to be a good doctor later on. It was very sporadic who had what experience, and so when the Aquifer Cases came about, this was a wonderful opportunity for me to make sure that each student was getting the same type of foundation. Cases worked really well because they were so brief. So at only 15 minutes, it wasn't asking them to do very much, and it was a topic that they were interested in. I chose just 2 cases to require my students to do, one that we thought was very foundational and another that was very relevant to inpatient internal medicine. And then they can feel free to do more, and many of them do more cases. And then I'm hoping that this gives them a deeper understanding when they're out talking to their patients about what the cost of their medications may mean and how this is going to affect their care later on. Looking at them now with the lens of someone who's teaching all 4 years of medical students, some of them would work very well at an early learner. Gives them a little taste of clinical medicine when they're eager for more of that. And so that is something that we're starting to figure out how to best integrate some of these cases earlier. And then some work very well for the 4th year when you're an acting intern and really having to make sure your patients have a plan that's going to work for them when they go home, and understanding about high value care is important to that as well. It has worked so well for our program because it allowed me the flexibility to keep doing the activities I'd already designed, but then making sure everyone had a similar foundation. And I didn't need to add extra faculty. I didn't need to pull students away from the clinical care of their patients. And they found it very easy to do, and I get pretty positive feedback about it. So I've been very active in the Clerkship Directors of Internal Medicine organization, and one of the things that we've done for many years is a survey of our fellow clerkship directors around the country. And one year we were able to ask about high value care, what clerkship directors were doing, what they felt their needs were, and their needs were very similar to mine. I felt like it's important, but I don't really have the curricular expertise or the resources, and so I'm hopeful that this will be a useful tool for some of those clerkship directors who are in the same position that I was in, wanting to teach this and just not quite sure how to deliver it.